When you think of bariatric or weight loss surgery, invasiveness probably comes to mind. Dr. Paul Enochs, a bariatric specialist of North Carolina, is here with me now to tell us about new developments that have led to a quicker recovery time. That is good news. So robotics have changed the game?
Yes, they have. Over the last few decades, there have been advances in surgery in general. About 50 years ago, we used to make a big incision and our hands went inside and kind of moved things around, which led to a longer recovery time.
Okay.
About 25 years ago was the advent of laparoscopic surgery, where we used our hands to control instruments that went through little incisions that touched the organs. About 5 years ago now, 3 to 5 years ago, was the advent of robotic surgery, where our hands control robotic arms that control the instruments that go through little incisions that touch the organs. As a result, you get better visualization, more refined or precise movements, which allows for less trauma to the abdominal wall and less trauma to the organs, allowing for quicker healing, quicker recovery, and quicker return to normal activity.
So is that just one single incision doing it that way?
Well, and actually the next step in robotic surgery has to do with, instead of going in through 4 or 5 incisions across the belly, actually going in through one single incision inside the belly button, where we can actually put the instruments through there, and when we're done, take everything out and the patients just have one little incision in the belly button.
So that means they can wear bikinis if they want to, right?
Exactly, exactly.
So less cosmetic issues.
Exactly. When patients are done, they can, and actually it helps our patients too from a weight loss surgery standpoint, because sometimes patients don't want other people to know they've had surgery, and they can go back to their normal activity without people even knowing they've had surgery.
Okay, what are revision procedures?
Revisional surgery has to do with patients who have had a weight loss surgery procedure in the past, and either the patient has failed the procedure or the procedure has failed the patient.
Okay.
And as a result, they've gained some of the weight back or developed some of their previous medical issues, and they're looking at another procedure to help revise that.
Okay, metabolic surgery is something else that we need to know about, isn't it?
Metabolic surgery has to do with the fact that one of the things that we've noticed when it comes to the gastric bypass and some of these other procedures is that patients would resolve their diabetes very quickly. And what we found was when patients had diabetes, significant diabetes, after the gastric bypass, before they even went home from the hospital, many of them resolved their medical issues. They cut their insulin requirements in half, and they were off all their diabetic medications within a few weeks. And they've taken that one step further now, and some research is being done now for patients that aren't overweight, but doing a procedure similar to the gastric bypass on, and the early results have shown a very good resolution of their diabetes.
Well, that is good news. Dr. Enochs, thank you so much.
Thank you.
You can learn more about Bariatric Specialist of North Carolina by calling them at 919-234-4468 and surgerync.com.